So with the fourth wave on our doorstep, South Africa has a long way to go in getting the majority of the population vaccinated. Many people are still unsure due to misinformation and unfounded beliefs. So what more can be done to get the message across? For more on this, I'm joined by Professor Hannelie Meyer, Chairperson of the National Immunisation Safety Expert Committee. Professor, thank you so much for joining us this evening. So we know there is vaccine hesitancy in South Africa. Any particular category in terms of age group we're looking at where it's more prevalent?
Well, if we look at the numbers, so you mentioned now we've been seeing, vaccination numbers are not that good. And if you look at what's happened, say, for instance, over the last weekend, on Sunday there was just under 12,000 vaccinations. On Saturday, about 26,000. So that's very little if we want to reach that goal of vaccinating 70% of the adult population by Christmas. So that is a problem. If you look at the percentage of people between the age of 18 and 34 being vaccinated, it's a low about 21%. And if we look at all the adults in South Africa as a percentage, it's only 36% at this stage. But in the elderly group, like mentioned before, it's now around 57% of the elderly people. So, yes, in the younger age groups, you can definitely see fewer people are actually going for the vaccinations, while, access has been really made a lot easier for people. So I think the government's done a lot in making the vaccines available. As we heard, we have enough vaccines to vaccinate people. We just need to get them into the arms now. So, there's lots of things being done to make access to the vaccines easy for people.
When it comes to the lowest acceptance rate, are we looking at more urban areas or is it rural areas? Because obviously in the urban areas, I would assume most of us are getting a lot of the fake news and social media and have access to social media.
Yes. Look, it's a known fact that if you look at all the surveys that's been done since the start of the pandemic, people who are hesitant, they rely mostly on social media for their information. And that is exactly where the misinformation is coming from. The World Health Organization, right at the start of the pandemic, they identified the infodemic, which is even worse than the pandemic, this whole spread of misinformation.
So what can we do to counter this misinformation? I know the government's tried a few things, the Department of Health even offering 100 Rand grocery vouchers just to get people to the vaccination sites, and it just doesn't seem to be working.
Yes. So those things are there to help people, who would say, no, I don't have money to get there. So it's to set off any additional costs for them to get to the vaccination sites, or maybe taking off from work and so on. But now they've also announced these lucky draws to make it now more appealing, especially I think for the younger ones to go forward and vaccinate. But as you say, it doesn't seem to be working. So with all this misinformation, I think, the government can only do so much. They are doing a lot in getting information out there. We can always do better. But I think now, we've come to a point where we ourselves need to say, what can I do? So, there's a lot of people who's got the right information, access to good information, who's positive, who's gone for vaccination. And I think this is now the time for them to step forward. So they've also created the opportunity of these Vax Champs, so vaccination champions. So they provide them with information and tools and so on. So I think, from a personal perspective, each and every one of us can actually do something to stop this misinformation. What people need to remember is what a person hears first is what sticks in your mind. So it sticks in your mind, and it's very difficult to now change that. So from an individual level, it's all about looking, around you, because often I think people send information And, you know, they don't do it intentionally to spread misinformation. So the golden rule is, if you don't know, if you are not sure, don't share. That's the first thing we.
The other thing is, Professor, you're saying, you know, individually, the first thing that you, whatever the first information received, that most likely will stick in your mind. But we've got people that have gone in for the first jab when it comes to the Pfizer vaccine, and then don't come back for the second jab. So if they came for the first jab, they were, you know, they were buying into the idea of getting vaccinated, and then all of a sudden, oh, you know what, maybe not so for the second jab.
Yeah. That's also a problem. That's definitely a problem. So it could be a couple of reasons for it. It could be that they have experienced some side effects and that they don't want to face any of that again. The second reason could be that maybe they don't know, they think. So some people think, well, I've got the first jab, I am fine now, I'm protected. But that's not true. You actually have very little protection still with the Pfizer. So you only have that excellent protection once you have had your second dose. And that will then protect you against severe disease, hospitalization, and death, which is the major, you know, aim and goal of the vaccination program. So yes, that is definitely a problem. So also people need to get that information to understand that after you've had your first dose, when you get your second dose, your immune system and your response gets sort of woken up. And then you mount a better response, which will give you much better protection, lasting for a much longer time. So that's another piece of information that should be going out there.
Indeed. Professor, thank you so much for joining us this evening. Interesting chatting with you. You know, it's problematic at the present moment. Let's hope, you know, the people that are actually pushing the real information, you know, let's hope that information gets out there a lot more than the fake information that we're getting all over the place. So National Immunization Safety Expert Committee Chairperson, Professor Hannelie Meyer, speaking to us there about the drop in numbers when it comes to vaccination throughout the country.